So I'd like to start with a general question that I'd like all of the panelists to speak with. And I might start with Dr. Kalidas, since she's over to my right to answer this question. But the question is really generally about what do partnerships mean to your organization, and what does building global partnerships that deliver mean to you and your organization, and how can we leverage the Global Health Catalyst as a foundation, as a launching pad to impact and really drive health equity and a more accessible landscape for healthcare globally? Dr. Kalidas.
Thank you, Jennifer, and a very good afternoon to everybody. It's really a pleasure for me to join this esteemed panel, so I very much appreciate the opportunity. And thank you once again, Jennifer, Catherine, and also the Global Health Catalyst team. Jennifer, to address your question, for us, partnerships are the way for us to have the impact that we want to achieve in our target communities. And when it comes to global health partnerships, the ability to have large-scale impact, that's what we are looking for. And for that, we can only do it through effective partnerships across the globe, through partners who are really committed to the same cause. So at Bayer, we have our Global Health Unit, which is part of our pharma division. And we also have our Bayer Foundation, which is the not-for-profit arm of Bayer. And we work in complementary ways to ensure that we can support our overall company mission of health for all. We also have the other part of the company mission, which is hunger for none. So we look at both health as well as hunger, and we work with multiple partners to achieve the goals. So I would say, when we look for partnerships, one of the key things we look for is, can we achieve scale? And is there transparency in the way we operate? And can we really demonstrate the impact we are having in terms of data that we can actually audit and submit as part of our company annual report? So it needs to be real impact, measurable, and something that we can also submit to our auditors. So it's that level of rigor is also important. So I would say that's what we look for when it comes to global partnerships: scale, reliability, and transparency.
Wonderful. Thanks so much, Dr. Kalidas. And I'd like to turn it over to each of the panelists on my left, maybe starting.
Same question?
Same question.
Okay, so thank you all for having me here. Global partnership is extremely important in, I think, everything that we do. For Nigeria, I think I gave an example earlier to Jennifer. There's so much that can be done if we have the right partners. Like the example that I gave earlier was that what happened when CHAI, BMS, and the Farber Institute come together. What happens is that for the first time ever, nivolumab is being launched in Nigeria. We don't have immunotherapy in the country. When they partnered with the government, after 4 years of trying to get it into the country, it's happening now. So that's what successful partnerships look like. And then people are going to be impacted, a difference is going to be made. I'm like, we have 220 million plus people in the country, but we need the right partners coming together to make it happen. Nigeria couldn't have done it on its own. BMS couldn't have done it on its own. CHAI, individually, everybody couldn't have done it on its own, but come October 21st, knock on wood, it's going to happen. We're going to start treating patients in the nivolumab. In fact, and I think that's such a round of applause, by the way, that for the first time ever, it's almost unbelievable that nivolumab has been around for so many years around the world, and we can't get in a country like Nigeria. So that is the impact of partnership. So it goes without saying, that's a classic example of what we've been able to achieve. and so on and so forth. And a good example is BVGH. There's so much that has been achieved in country, like the Access Program, where they've been able to impact, create so much impact and train so many of our physicians and clinicians and health, other leaders of the healthcare sector just by partnering with the government and other members of other organizations in the country. So partnerships are such a strong part of what we need to create success in our country, Nigeria, and I'm sure other parts of Africa. Thank you.
Thank you, Dr.
Thank you, Jennifer, for the question and having the panel. For us at the She Center, partnership means believing in the same mission. Because I think you mentioned that you know, we can do the things we want to do, but the sustainability of it and the ripple effect of it, we can get with partnership. For example, before Dana-Farber endorsed the She Center, we were doing a lot of work kind of under the radar, you know, as a basic scientist. How many basic scientists are in the room here? Raise your hand. Yeah, not very many of us. We do everything under the radar. We get funding, we do the work, we don't advertise it, especially before social media. We publish, but we didn't advertise it. And that's what we did. You know, I went to Jordan, Iran, UAE, and I did the work. We got small amount of funding. But the partnership with Dana-Farber, with the leadership, when they found out what we were doing, they backed us up. That gave us the momentum. That gave us that ripple effect, that it gave rise to endorsement of the She Center, gave rise to NIH recognizing us. So partnership for us is really sustainability, belief in the same mission and goals, and bringing people together that want to solve the same challenge, especially in non-communicable diseases.
Yeah, thanks, Jennifer. For us at the Society for Immunotherapy of Cancer, we're passionate about advancing the science and application of cancer immunotherapy worldwide. SITC is an organization that will be 40 years old in November, actually, in a couple of months for our annual meeting. That has members from the industry and academia that are involved in the science of immunotherapy, but also in the treatment and the education and learning. So we would love to partner with others as well to advance this mission worldwide, not just what we've been doing, mostly in the advanced countries where most of the science is done. We have the expertise, we have the passionate volunteers who would like to share the training, but also share ideas about research. You mentioned the Oncology Research Information Exchange Network that we're involved with as well, where we have an alliance with 20 cancer centers and a prospective protocol that can sense patients who donate or volunteer to give us their information, their blood and tumor for us to sequence thousands of patients that can form gold mines of data for research. Would love to share that expertise as well. I think that we can share and answer a lot of questions, especially in low middle income countries where most of the research that we do is being done here, and we have minimal let's say enrollment of patients from low middle income countries, but the guidelines that go into the treatment applies all over the world. How can we really partner to advance clinical research, but also translational research and basic science research in other countries as well? So that is the kind of vision that we have at SITC would like to share.
Wonderful, thank you. I'm going to put Dr. Adeyemi back on the spot, and I'm also going to put Professor Tarhini on the spot, also with Professor Lavoisier from the DRC afterwards, so I'm just letting you both know. But to start with Dr. Adeyemi, I'm wondering if you're just hearing all of these voices, right? You've heard from Dr. Kalidas about Bayer and their commitment, and they're very active in Nigeria. And you've heard both from Dr. Madani and Dr. Tarhini. Like, how can Nigeria really be foundational to engaging all of these partners in achieving a common goal that will have impact for researchers, for patients, most importantly in Nigeria? I mean, what do you see kind of as the possibilities coming away from this summit and this panel, as well as the audience that we have?
I think one of the strengths of having platforms like this is to be able to talk about what we really need. One of the challenges that we've had in the past is having organizations or foundations do things that they want to give. Like say, okay, this is the plan, we want to give you this. But having the opportunity to talk about it, to say that, hey, we're excited about all the money you have to bring or all the technical expertise you have to bring, but this is what we need. And so for instance, I think your SHE program is amazing, right? I think you've done phenomenal work. Could that possibly something that we could benefit from? Absolutely. So having a conversation to learn from you to say that, hey, I think we need this. Is that something we can replicate? And who can help us replicate? Can we learn from you? That's a conversation. Hey, I know Bayer's already working in Nigeria. Like, hey, Bayer, can you help us do what, what's going on here in Nigeria and so on and so forth. I think having a space where we can talk about things like that. BVJ, you've worked in Nigeria so much, like can you facilitate some of these things? I think that's the beauty of being in places like this, spaces like this where we can have these conversations and tie things together versus, some of the things that we've had occur and why it doesn't succeed or it's not sustainable. And then having a voice like the government versus, okay, we need this and we can put human resources and the necessary finances possible to match what is already going on. That's what we like to see and that's what we like to talk about.
I think that's a great actual transition because, I think that we've all heard about really respecting our partners in country and making sure they're at the table setting the agenda. And we heard that, we're gonna see a big contingent, probably the biggest contingent from Nigeria next week in New York at UNGA. But we heard from the Democratic Republic of the Congo team yesterday about the commitment that the government is now making toward cancer care. And we also had a small discussion between Professor Tarhini and Professor Lavoisier representing the DRC team about the potential for partnerships and collaboration between SITC and some of SITC's goals and societies in general of how you can leverage what are the priorities of the DRC team and tap into the resources of organizations like SITC. I think we also have Professor Julie Grelo, who's the Chief Medical Officer of ASCO, which is a huge champion in this area, so organizations like ASCO as well. But maybe, Professor Tarhini, you could speak to a little bit about the discussion we had and the potential you see for SITC to engage. And then Professor Lavoisier, if you have any comments, we'd certainly welcome you to come up and share those as well.
Yeah, thank you, Jennifer, for bringing us together. It was a pleasure meeting Dr. Lavoisier. And, as I said, SITC, we're primarily educators. We have the expertise. And at the same time, we think we can act as conveners where we can bring stakeholders together. With Dr. Lavoisier, we talked about how can we share expertise in terms of certain needs that may be related to education and training, possibly how to develop a comprehensive cancer registry, for example, expertise how to develop a biobank, or expertise how to share protocols that we use, for example, to do RNA sequencing, exome sequencing, all these testing that we do through the RNA network. So these are the kind of things that we can we can share. In SITC, for example, we have guidelines to treat different types of cancers with immunotherapy, management of immune-related adverse events, etc. How can we sit down and learn about the needs, specific situations to the region, that we need to learn really and see if we can share our expertise to develop those guidelines to help patients with HIV or patients, other situations that are of need that are not covered by national guidelines like SITC and ASCO, and others. So we feel there's, a lot of potential for collaborations, and would love to talk more and start coming down with specific goals that we can work towards.
Wonderful, and I think what we did not learn about today is Professor Tarhini actually has 3 brothers and a brother that is based in Kinshasa. So that's an added link too, which can really, I think, catalyze impact. Professor Leboisi, did you want to say anything at all about just the partnership potential?
No, thank you so
You
much,
can-
Jennifer, for. Yeah. Thank you so much for Jennifer for connection. And what I can say, Professor Tarhini is a Congolese because you have a big family in Kinshasa. Welcome to Kinshasa. I'll be very, very happy to meet you in Kinshasa. For our future collaboration. It was future. Just say that. We discussed maybe on Thursday, New York or by Zoom. So I think it will be the beginning of the future. Thank you so much.
Yeah, excited for the collaboration.
Madani, you had something
I
to
wanted
add. Yeah.
quickly to add something with regards to collaboration and with regards to what was said about nivolumab being in Nigeria. I'm very, very excited about that. I touched on this on Friday night. We need more data coming out of resource-limited settings with regards to these new immunotherapy drugs that are coming out. I was actually part of the clinical trials with nivolumab at Dana-Farber about 3 years ago. And when I asked my doctor, how many people on nivolumab look like me? She said none. So 95% plus of people on clinical trials are of Northern European population. So we need data on the rest, that is majority of population in the world, So I'm really excited that you said that nivolumab, it didn't work for me. On paper it didn't work, but I do think part of the reason I'm sitting here is because of nivolumab. But I want to be able to partner to write about the data, write about what happened with nivolumab with this many women or this many men in Nigeria, and have this kind of conversations, this kind of data coming out in peer-reviewed journals.
We definitely need more data coming out of Africa, and I want to turn it over to Dr. Kalidas again, because she's been a real leader in really championing the non-competitive space across industry to drive clinical research in Africa and other regions where data is lacking. So Dr. Kalidas, could you maybe speak about some of the partnerships or the initiatives you've been involved in, and where you see potential for research partnerships and partnerships that will deliver access?
Yes, sure. Thank you, Jennifer, for the question. I'd like to start with one example in Egypt, which has really served as a blueprint for how we can have public-private collaboration, which can in turn lead to many more companies joining that effort and really adding value to a country that is facing a heavy burden from liver cancer. And then I'd like to branch out into another area where I would welcome partnerships from other organizations as well, and that is in the area of pediatric brain tumor. So with the liver cancer, what I'd like to say, when we started, Bayer had two therapies already registered in Egypt for liver cancer, metastatic liver cancer, both the first line and the second line at that time, which is more than 10 years ago. But what we saw was that the uptake of these medicines is very low. And what was worse was the outcomes that we were seeing in Egypt, which has one of the largest numbers of liver cancer cases in the world. we were not seeing the same types of outcomes in Egypt that we were seeing in, let's say, North America or Europe. And when we dug into the reason for that, or the reasons for it, was often the late diagnosis and the delays in treatment that was causing it. So we had to engage in public-private partnership, which actually was a wonderful partnership with the Ministry of Health and Population in Egypt. And it was also part of the 100 Million Healthy Lives Initiative, which was backed by their president. And what we needed to do at that time was to really build the capacity for liver cancer diagnosis and treatment. And so this was really not even a commercial effort. We focused on strengthening the health systems, and over 100 specialty centers, creating the ability to diagnose and treat liver cancer at over 100 centers was what we were able to achieve. And over 400 healthcare professionals were trained specifically on liver cancer, and we were able to bring the Barcelona Clinic liver cancer team to actually train the experts, liver cancer experts in Egypt, and create centers of excellence within Egypt, which I'm very happy to say we are now able to create centers of excellence. As you know very well, Jennifer, we are working with you and the BBGH team to create these centers of excellence in Nigeria and other countries in sub-Saharan Africa. So for us, that is an example where we were able to work with multiple partners to strengthen the healthcare system to address a very important burden of cancer that Egypt was facing. And what I'm also happy to share is the ministry is now working with multiple pharma companies. We were one of the first to start this, but then it is continuing through the efforts of other pharma companies, and the effort is continuing. So I would say that this is similar to building a road where anybody with a car can drive. So it was not built with the intention of only selling our products. At that time, yes, the goal was to achieve similar outcomes or comparable outcomes in Egypt as we were seeing in, say, North America or Europe. But now it's something that is continuing, and to Dr. Madani's point, this is where the sustainability comes in, right? That it's not one time and done. It serves as a blueprint, and others can make use of the effort and build on it further. So we are very proud of this effort in Egypt, which was possible also, similar to what was said earlier. It required a lot of sponsorship or support for an effort that initially was small, and then it blossomed into a much larger effort. So that is about liver cancer. And the other example that I mentioned is pediatric brain tumor. This is a global pediatric brain tumor network that has been initiated by Bayer in partnership with Duke University, the National Brain Tumor Society, and also OHSL, which is Open Health Systems Laboratory, which is an academic institution. And the goal here is to have a common technology platform to help support treatment of children suffering from brain tumor all around the world. And this again goes to the point of being able to generate data. So it's a rare condition, but it does have a huge impact on children who have this condition. So every child, the data from every child is so special because it can help that patient, that child, but it can also help children, other children who face this condition in the future. And the important part is that according to the WHO classification of pediatric brain tumor, being able to screen for the genomic profile of the tumor is important. So it's a very hard nut to crack, but with the help of diagnostics companies, technology companies, and pharma companies, we can make a difference in this very difficult to treat condition in children. And that's where we are looking for partners. I mentioned a few partners that are already working with us, but we are open to working with other pharma companies and diagnostics companies to really make this a wonderful case study of how the industry came together and cracked a very hard problem. And that can then serve as a blueprint for cracking many other difficult problems, both in the pediatric space and adult space.
Thank you, Dr. Kalidas. Could you also maybe speak just for a moment about, you've been a leader in the Bloomberg International Cancer Coalition, and we have an event that Dr. Catherine Young is championing and leading next Thursday in New York. Could you perhaps speak to some of the ambitions of that initiative in the area of the conduct of cancer clinical trials in low and middle income countries? Because I think that links with, some of the points that have been brought up by the other panelists.
Sure, happy to do so. Bayer has had the privilege of being a founding member of the Coalition for Cancer that the Bloomberg team had started, the Bloomberg New Economy initiative had started. And thanks to Dr. Catherine Young and yourself, Jennifer, and Dr. Julie Graylow, we will have a wonderful reception that will attract hopefully many interested partners at UNGA. And the focus of this coalition has been to really bring together, make this an international movement for enabling greater equity in cancer care. So we have focused on the emerging economies, of course, sub-Saharan Africa, India, and what we have focused on is also, how do we build capacity for clinical trials? How do we build capacity for diagnostics? Because in some cases, if we don't have the diagnostics, patients will not have access to precision oncology. But the goal is to really bring together multiple centers across the world, really serve as a platform for convening various initiatives, with the focus being, yes, enabling access to cancer clinical trials and also access to new therapies that come through these trials. So clinical trials is the first way of gaining access to an innovative therapy, and then subsequently also access to essential and innovative therapies in countries that currently do not have access to these therapies. So I think it's a wonderful initiative. I'm also very happy that we are talking about the Global Cancer Fund, because that is very much needed. One of the challenges that I've faced is that, every company has its own initiative, but when we look at scale, we cannot achieve this on our own. And I think to Dr. Adeyemi's comment earlier, Bayer cannot do it alone. We would love to hold hands with others, but we need that platform as well as a space that gives comfort that there is a lot of transparency and high quality effort that will be possible through these coalitions and the platform. So I'm really excited about the Global Cancer Fund and looking forward to the outcome of the discussion in New York.
Thanks so much, Chitkala. And I want to bring it over to Professor Tarhini again, and just ask him, are there barriers that scientific oncology societies might see in actually, connecting, building capacity, building partnerships with countries, with oncologists, with governments in Africa? And I think with the panelists that we have together with us today, maybe we can help to brainstorm and break down some of those barriers.
I don't honestly foresee barriers in terms of the willingness to collaborate. So our committee, for example, we have members from all over the world, from Africa, China, Europe, US, etc., Australia. So we have passionate members that would like to make a difference. So the willingness to collaborate is there, no barriers. The key thing becomes obviously finding the resources and the funding, and this is where I think also we can work together, as conveners, but also as advisors, those of us in terms of grant development and setting goals and specific aims to achieve. As we look for sort of resources, we look for funding, etc. The main thing will be the resources.
And that's really what we're all here. The Global Health Catalyst Summit is all about partnerships and connections. And so, I think that there's just so many opportunities that I think the Global Health Catalyst has presented to all of us here in this room. I'd like to, I think we want to stay on time, so I think we're going to move forward, but I'd like to ask each of the panelists to speak for less than a minute about a concrete, action and partnership that you could see coming away from this summit as potentially moving forward to improve equity, access, and really a more just world. I mean, we heard, I think, some amazing presentations. One that really moved me yesterday was from Dr. Madani's postdoc student about the lack of equity. And I think we all want a more just, more equitable world. And I just also want to say that the young catalysts give me great hope, because I believe that the young catalysts, how they acquire information, data, is so much smarter than me and maybe people of my age. And it gives me hope that we will have a more just and equal world for cancer patients, but all people to live a healthy and safe and good life. And so that's probably my close, but I want to go on to the panelists to maybe answer that question. Maybe Prof. Tarhini, since you're at that end, I'll ask you to start about, like, what are you going to take away as a concrete action next step that can really, through partnership, have impact for SITC, maybe even for Moffitt too, or some of your other initiatives?
Yeah, no, certainly for SITC, I think most of what was discussed today are things that are being brought up in our committee. And we have members, and you may have seen this when you joined our last meeting, would like to achieve things in Senegal, in other parts of Africa and worldwide. So I see really that there is potential for learning and collaboration, and the great things being done through the Global Ecology University and other things that we can learn from and probably partner with to achieve things.
Okay. So I was writing things down as we were talking about, collaborations and everything. So at the She Center, we believe in butterfly effect. Small changes give rise to a tsunami of positive changes. So if we empower one physician in Nigeria, one physician in Jordan, in Morocco, in Bangladesh, we can empower multiple people. Also, what I've come to get out of this last 3 days is, like you said, Jennifer, is the young generation. I am just so impressed with you guys. Every talk that I've heard from all of you has been wonderful. So what I want to take out of this is collaboration. I want to come to University of South Florida. I want to talk to you guys more. I want to link you guys with our mentees in the Middle East and North Africa. And I want to come to Nigeria and find,
Moffitt is next door to you.
Yes, so that's my thing. It's butterfly effect. We do smaller steps. When you're trying to go up the stairs, if the steps are high, it's going to be hard. But you can do little ones and you can go up faster. So that's our motto, and I hope we can achieve it through collaboration.
And the follow-up to that, for me, it's old partnerships and new partnerships. Continue working with the people we're already working with, obviously like BDGH, and strengthen what we're doing in Nigeria, but also new partnerships. Definitely we're going to work with She, and also Dr. Aditi, we're going to work with you. And then also Bayer, we're going to work with Bayer. So
Yes.
Old and new partnerships. As many people as possible. But those ones, concretely, I can say that definitely, we make connections that we're going to work on. Thank you.
Thank you. I think for us as well, building on old partnerships and exploring new partnerships is definitely a goal. Since we have a huge focus on prostate cancer, and we are already working with you, Jennifer, on liver cancer, and you know about our activities in prostate cancer, we intend to broaden that effort and to really focus on Africa and especially Western Africa, including Nigeria. That's a focus for us. And as I mentioned, focus on precision oncology, similar to the Brain Cancer Network. That is a focus for us, and we hope to enable or engage in a coalition that will be focused on bringing precision oncology to Africa.
Thank you so much, Chitkala. And now it is my pleasure to thank the panelists. So one round of applause for our panelists. And I am going to turn it over to my colleague, Dr. Catherine Young, to moderate and chair the final session.